Finding the right medication is getting easier for some Californians. Earlier this month, Governor Newsom signed a bill allowing those on Medi-Cal to cover pharmacogenomics, also known as drug gene testing. And it could be a game changer for those taking prescription drugs. Joining us live this morning is Brad Tice, CEO of RxGenomix and former president of the American Pharmacists Association. Brad, good morning. Thanks for joining us.
Good morning. I'm glad to be here.
So what is drug gene testing and how is it done?
Yeah, it's really testing a person's DNA, really similar to the 23andMe test, just as a saliva test, very easy to do. Now we can understand how people respond to medications more specific to them and get them on the right doses of medications and even the right medications a lot faster. So we avoid unwanted side effects and really help people feel better faster.
Sounds like a very user-friendly process. Which patients are the most likely to get a big benefit from drugs tailored to their genes, and how much of a difference can this make?
We're really seeing, as this gets more understood and more highly utilized, really significant differences in people's lives every day. There are actually over 100 medications on the FDA's website with known clinical and safety benefit from having this testing done. There's several medications that actually have black box warnings, the highest warning that the FDA can put on medications recommending that genetic testing can help with medication use. There's even 26 treatment guidelines developed by healthcare professionals to help them guide them in how to apply this science into clinical practice. We're talking categories like depression and anxiety, heart disease, blood pressure, stroke, very common conditions, but even a lot of benefit in oncology and cancer. And so it really applies across a wide breadth of conditions.
You've been seeing this whole process unfold. What examples have you personally seen where this has helped someone?
Yeah, so just a few. We get them every day, but there was one family, one parent, a set of parents that it's actually on our website that have a testimonial where they had a young son who couldn't really even get dressed in the morning, and they struggled for a couple of years to find the right medication for them. They stumbled upon pharmacogenomics testing. This was a couple of years ago where it wasn't as kind of widely known. It still has a long ways to go there, but they were able to then understand what medications that he would respond to. They got him on the right medications. He's a fully functioning adult, holds a job, and is very successful, and even recently got married. And so they even say they believe this saved their son's life. There's other examples of a grandchild or a grandparent who she could not get her blood pressure under control, and she really just wanted to spend more time with her grandchildren, quality of life, and she was able to get tested, get her blood pressure under control, and is doing very well. And I even recently, I saw the story about Panera and the parents with the child who they alleged died from the hypercaffeinated drink. We can actually tell how people metabolize caffeine and who is going to be a slow metabolizer. You just have to wonder if that could have made a difference in their life.
Yeah, it sounds like it really worked out in these cases and that there's a lot of potential for this to help a lot of different people. On the other side of things, there are some concerns that because this is so new, doctors might interpret the same results differently. For example, maybe one doctor believes a patient will respond well to a medication while another thinks that they won't. How would you respond to those concerns?
Yeah, I think you really have to, I'm probably biased as a doctor of pharmacy that, I think get a pharmacist who has really been trained and knows the medication use, and get a third opinion if you need it. There's certainly different physicians, different prescribers that do what they're comfortable with, and they want to make sure that they're taking care of patients. And I believe they all have the best intentions with patients, but there's certainly going to be some disagreements. But I think that's where the treatment guidelines that have been developed is actually an organization. It's called the Clinical Pharmacogenetic Implementation Consortium. It's over 600 healthcare professionals that have come together to really review the literature and provide the guidance on what's going to work in people's lives and how to apply this science into clinical practice.
All of this very fascinating, a new option for people out there. Brad, we appreciate you. Thank you so much for talking with us.
I appreciate it, and thank you. Just enjoy the opportunity to get this information out there. Thank you.
Absolutely.